So how would I get started? How would I know if I qualify for a trial? The information on clinicaltrials.gov is sometimes really confusing to look through and to figure out. So what would you suggest?
Again, that's a very important question. The best way to know, as I tell my patients, is to ask your provider. You can also contact the clinical trial team because in this age of information, everything is just a click away. So whenever you go to clinicaltrials.gov, they provide you information on the primary site of that clinical trial or the investigator, the clinical investigator. You can ask your provider to contact that investigator, or you can contact the investigator or their team directly, and they can provide you information on that trial. Several other options that are available to patients are patient advocacy groups, such as Longevity or the GoTo Foundation, as we very well know, are some of those groups that do a lot of work related to lung cancer. And there's also some groups, as Ms. Elkins knows very well, that are focused towards EGFR, such as the EGFR resistors or the ALK positive, or the ROS1-DERs, as they call it on the social media platforms. So there's different avenues that one can avail, and the first step, I think, is talk to your primary oncologist, primary cancer provider, or if it's a radiation oncologist, if it's a medical oncologist, and they should be able to direct you. But step beyond that is there's always information available, and once you contact the relevant team, they'd be happy to guide you.
I'll just add that this idea of qualifying for a trial is called, just generally, the umbrella term is eligibility. And I think increasingly with how medicine is being delivered, what we're realizing is that the things, how we used to categorize clinical trials based on, for example, where the cancer started, lung cancer, or cancer that started in the breast, we're actually finding there's more and more clinical trials that are considered basket trials, meaning that it's not necessarily only for breast cancer patients, only for lung cancer patients, but it's for patients who have a specific mutation, and that the drug may have some efficacy or some tumor killing action across many different types of cancer. And those trials, I think, are blessings and curses because they can really open up a potential treatment to many different types of patients, and they can really help raise the field in terms of cancer research. But they may be also quite limited in terms of where they're being actually provided at. And so that's the last thing I'll say in terms of the eligibility, is that the trial you may be eligible for it, but it may be sort of out of your reach in terms of like travel or distance.
That's definitely an issue. We'll talk about it a little bit more later, but that's definitely an issue that many patients deal with when they're deciding whether they can participate in a clinical trial.